My name is Lori Stamball. I am a nurse and I'm the community educator at Henry County Medical Center. I have with me Jackie O'Brien, who is director of our infection control, and I also have Neely Ashby with me, who is our chief nursing officer. So we're just going to kind of talk to you today, and then at the end we will open it up for questions. We're just going to kind of give you the facts, because I know there's a lot of stuff going around right now about coronavirus. That's pretty much all we can hear. Turn on your news, open up your phones, that's all that you can see. And there is a lot of misinformation circulating around, which is one reason why we wanted to do this. And then we're going to tell you about what we are doing to be prepared as a hospital to be able to protect our community. So I'm going to start with the facts about the coronavirus. You may have heard or seen on Facebook where you see a lot of the fake news, people sharing the bottles of Lysol. Coronavirus has been around for a while. It was first identified in the 60s. It is a classification of diseases that can cause something like the common cold. A lot of us have probably had it at one point or another in our lives. However, this one that we're dealing with now, you may have heard it called the novel coronavirus. It means it's a new one. It's a new version that we have. It's only been around a few months. I'm sure you've all heard it originated, they believe, in China. And it has gradually made its way over to the United States. So here's what we need to know about it. Symptoms. Main symptoms from it are fever and a dry cough, and then shortness of breath. When it becomes dangerous is when it progresses on to pneumonia, which can, of course, lead to death. Greatest risk for it is our elderly population, those around 60 and over. Anyone who is immunocompromised, someone who's going through chemotherapy, radiation, on drugs, medications that cause you to become immunocompromised, people with chronic heart, lung disease, diabetes. All these people are our population that is at risk. And what I'm telling you is information that we know today. It changes, so you have to constantly watch your credible sites to see what is being said about it each day, because they are doing testing on it every day and finding out new things about it as we go along. So these are the facts for right now. Transmission is being spread from person to person, mainly through respiratory droplets. That's why they're cautioning you, keep that 6 foot of distance between you and someone else, especially if they are coughing, if they have any kind of signs or symptoms of anything. You want to keep that distance pretty much from anyone. It can be spread, they think, by touching objects, but it's not as likely. And this is what they're thinking right now. This could change, okay? They could do more research in a few weeks, a few months, and say, we were wrong about that. But right now, this is what the CDC, Centers for Disease Control, believe is going on. So we have to be vigilant about what we're doing. So what can we do? If you become ill, you want to stay home. And I know that's hard in this day and age because we feel expectations to be at work. We don't want to not be there. We've got activities going on. But if you are ill, you don't want to go out and be out exposing this to other people, Hand washing. Y'all, that is the #1 thing you can do. I've been a nurse for over 20 years, and that is one of the very first things I learned in nursing school. Do you know that they actually check you off on that in nursing school, that you have to wash your hands? How long do you want to wash your hands for? 20 seconds, everybody knows. That is a lot longer than what you think. And we've all used public restrooms. How many people do you see in the public restrooms that are washing their hands when you do that do it for a full 20 seconds? Not many. Not many. So you want to make sure you rub your hands really good together, because that creates the friction that gets those microbes and those germs off. You want to scrub underneath your fingernails You just want to do it as well as you can. I know y'all heard it, but probably humming the happy birthday song twice. There's lots of other songs that have been spread now that you can hum. Whatever you want to hum, I don't care. Just do it for the 20 seconds. Hand sanitizer. If you are not somewhere where you can wash your hands, use hand sanitizer. It's a backup. It's not a first line of defense. First line of defense is washing your hands. Take hand sanitizer with you everywhere. We've got some here today. You want it to have at least 60% alcohol in it. So make sure you look on the label, and it's going to say, sorry, something happened to somebody. It will tell you on the label, these are 62%. That's the majority of what I see will say 62%, but you want it to be 60% or more on your hand sanitizer. Those are the best things that you can do to protect yourself. Avoid touching your eyes, nose, and mouth, especially when you're out in public. Cover your cough with a tissue, preferably. Throw it away. If not, use your elbow. Just make sure that you're not like coughing over your elbow. You want to cough into it because what you're trying to do is prevent those droplets from going through the air. Okay? I saw a pediatrician that was speaking last night and was talking about for kids, how do you get kids to do this? Tell them to sneeze or cough into their shirts, and that way it goes against their skin. Okay? Clean and disinfect regularly touched objects, doorknobs, phones are a big source. Encourage your kids, your teens, to wash their phones constantly and disinfect. I know y'all have probably all seen the stuff on the news of the people in China walking around in all of their garb, their masks. I've seen people in Tennessee with Dollar General sacks on their feet and head, and y'all, that's not going to do anything for you, okay? The CDC is not even recommending masks, okay? I know everybody's been trying to buy up masks and stuff. They are not recommending that unless you are sick. If you are sick, wear a mask. Now, if you are in one of that class of people that are immunocompromised or whatever, and your physician has told you wear a mask in public, then yes, continue to do so. And if you're in doubt, of course, check with your primary care provider and ask them, do I need to have a mask on? But the general guidelines for the general population is that a mask is not needed. Healthcare workers, absolutely, they need to be wearing masks, especially when they are taking care of patients or anyone that could be suspected of having any kind of respiratory illness that could be possibly identified as the coronavirus. I'm going to talk to you a little bit about statistics right now. And this is from the CDC website. They're updating it daily. For the United States, right now we have 1,215 cases, 36 deaths, and it's spread throughout 42 states, plus the District of Columbia. And that's information that you guys can access at any time. For Tennessee, and this is on the Tennessee Department of Health website, and I'll go ahead and tell you, you can go to our website at the hospital and we have links to all of these websites on it. Okay, so you can Google HCMC, you can Google these, and you will be able to find it. So in Tennessee so far, as of 2 p.m. today, what has been reported is there's been 18 positive tests. 8 are in Williamson County, 2 in Shelby, 1 in Sullivan, 6 in Davidson, and 1 in Knox. So right now, we have not had any positive tests in our community, okay? And they are being very transparent with us, releasing this information daily. So I think the most important thing for us to remember with this is we want to be aware, okay? We definitely want to be aware. We want to be prepared. We don't want to panic, okay? That's what a lot of people have been doing. Who's been to Walmart and seen the toilet paper aisle? Okay? Toilet paper has nothing to do with coronavirus. But we are in a society that it's me, I gotta take care of me and my family, which is fine, but you kind of got to think about the greater good too. If you are in one of those high-risk groups, it is not a bad idea, and even the CDC will recommend it. If you go to their website, they have all kinds of recommendations out there for everybody, businesses, schools. So I advise you, go to their website and look. But they will tell you, if you're in one of the higher-risk groups, yes, it's smart to have maybe a 2-week supply of stuff, but those groups should already have that. We are in the midst of flu season. Anyone could get the flu, any other kind of illness at any time, and be stuck at home for a week or two. So in general, that's just a good idea. This is nothing new, okay? The transmission spread like the flu. That's really nothing new. This is just something else, something new that we're having to deal with, but it's very similar to other things we have dealt with. So just don't panic. Be careful about where you're getting your information from. That is the biggest thing I can stress. You see someone share something on Facebook. Did it come from a credible source? Do you know that it did? Sometimes it will say NBC News or whatever, but it's not really NBC News. Go to their websites. Check it out. Don't believe everything you see. And then when you go down and you look under the comments and somebody's brother's wife who lives in whatever has said, well, this is this. Oh, well, that's true. It's got to be true, y'all. No. And that is part of what is causing a lot of the panic, is because we have social media so readily available now, and people buy into what is on there. So look to your health professionals, look to your physician, look to your reputable sites, the CDC, the World Health Organization, Tennessee Department of Health. Those are the sites you want to check for information, okay?
I'm trying to not say the same thing that Lori said, but give you some information. The hospital has done a really, really good job at getting things prepared should we get any cases. Like Lori mentioned, we have no positive cases in the community at this time. We don't know that we will. It's impossible to know. But what we do know is that we have to be smart about it. There's a study that shows that we touch our face probably 30 times within an hour, right? And so every time you're touching your face, anything that's on your hands is now in your face. What's your mucous membranes? Your eyes, your nose, your mouth, right? So that's hard to do. Sometimes just changing practice or changing, your behavior and remembering not to touch your face. Because right now I've touched the table, I touched the handle of the door, I'm touching a book that I shared with other people. So I don't know on what I touched in order to know if my hands are safe enough to touch my face, right? We are in the middle of flu season. We're starting to see a slight decline. So a lot of the cases that we have are people that are scared and say, oh my God, I think I have coronavirus. You also might have a cold, or you might have seasonal allergies because we have beautiful trees blooming right now. So there is lots of opportunity to have symptoms that could even somewhat resemble what the coronavirus is. We are taking it very seriously. It's not that we're underestimating this virus at all, because we don't know. This is brand new. What we do know is that it spreads pretty easily. And that means that if I'm within 6 feet of someone and they're sneezing, I could potentially breathe it in. Now, if you're across the room from me, can you get it? Probably not. Probably not, because gravity's going to pull down droplets. Droplets have weight. So they're going to, don't eat off the floor would be my rule for you. The 5-second rule doesn't apply. But the main thing is just remembering these good behaviors. I have a granddaughter who's in Head Start, and every day we take her in, we take her coat off, she goes and washes her hands. She's 18 months. So an 18-month-old can learn behaviors that as adults we often have difficulty remembering. And so, I know that infection control has been really important in getting some of these things changed. We screamed from the top of mountains and said, we need more nursing education on infection control. We need more physician education. And we need it in schools. So that's why, you know, I don't know how many of you have little people in your lives, but we've had to take in alcohol hand sanitizer, or you take in Kleenexes or different things. There's a good reason for that, because we're trying to help contain by having everybody support those good behaviors. You know, Lori had mentioned about highest risk. Personally, I'm well. I'm not really worried about myself getting the coronavirus. I figure I'll have, if I get exposed, I'll have it a couple days, probably be cranky, you know, but then I'll be fine. The people that are the ones that need to take the greatest steps are the ones over 80. They are the number one group. And the ones who are over 80 with other problems. If you have, you know, heart disease and diabetes and different things, that makes you at additional risk. So.
So what we have asked is, just in the past couple of days, is we've been in contact with our primary care providers, both that are employed with the hospital and those that are not. If you feel sick, if you have a fever, if you are short of breath, if you just generally don't feel well, the physician's offices are asking for you to call ahead and let them know those things ahead of time. Especially if you've been in contact with someone who has been exposed or has traveled abroad or been in an airport. They want to know those things ahead of time. And this is what will happen if that does occur. If you go to your doctor's office and they suspect that maybe you may need to be tested for that, they're going to call the hospital, and we are going to get your name, your birth date, your information over the telephone, and we're going to have you pull up to the emergency room parking lot and not get out of your car. There's going to be a nurse and a registration clerk that come out to your vehicle and do the test in the car. Right. You will not be an emergency room patient. You would be that'd be an outpatient lab that you were coming to have done, just like if you were coming to have blood drawn for a thyroid test. Now, you will have to bring an order from your doctor's office. People cannot just pull up in the ER parking lot to be tested for this. You cannot do that. Of course, if you are sick and it's after hours and you're not able to go to your doctor's office, you would come and you would check in the emergency room just like anybody else and be treated in the emergency room. The one change in the emergency room is that there is a new form that you will fill out the minute you walk in the door that says, have you had a fever? Have you traveled? Have you been exposed to somebody who has done these things? If you answer yes to those, they're going to put a mask on you right then. A couple of days. The lab test, it is a oral pharyngeal swab. And it is sent to LabCorp, is the lab that's doing that. And our turnaround time is about 24 to 36 hours to get that test result back. We haven't seen any positives in Henry County. There's no vaccination, no antibiotics for this. Of course, if you get a secondary infection, that's where the antibiotics would come in at. But as far as for the coronavirus itself, there is not. So if you have not traveled abroad, if you have been here in Henry County and just been working and going to school, whatever, and you come down with a cough and a 99.5 fever, typically I'm going to take Advil, maybe some cough drops, maybe some cough medicine, and that's it. I'm going to stay home until I don't have a fever. Work in healthcare, we don't, and the schools have their rules about when you send your kids back to school. And then that's typically it. It's what we've normally done. Now, if you have been to the Bahamas and you've traveled through the airport in Florida, you've been on an airplane with people who've traveled internationally, you develop a fever, cough. If you're not any sicker than that, there's no reason to go and get tested for it because we're not going to do anything. But if you become short of breath, run a very high fever that doesn't respond to Advil, Tylenol, just like if you had the flu, then you would go see your primary care physician. They're saying 10 to 14 days. If you are have been exposed in those ways. Tested positive.
Greater than 80% of the people that get it get a very mild case, probably no more sick than a bad cold. It's only the people, you know, as you age, and I don't want to say 60s old because that was scary to me. But, you know, I mean, they did say the elderly, greater than 80, you are at risk, and that's where, you know, the greatest concern should be.
And one of the other things that they're talking about is social distancing. So those of you that are all close to one another over there, greater keep a distance of 6 feet between people when you're in public. So that's the most important thing. And wash your hands and keep your hands off your face.
They talk